Hi, this is Dr. Kevin Smith. Thank you very much for checking out this video on hidden secret number 4 of why you can still have back pain problems. In this video, we're going to talk about core weakness. The core is a group of muscles that exist between your diaphragm and the middle of your thigh, on the front and the back part of your body. The core is not just your abs. And that is something that I have to say right off the bat. That's when I go to the gym and I see people just working on abdominal exercises and they think that they're training their core. They're missing a very big part of the picture, because your core is not just the front. It also involves the muscles in the back. It also involves the glutes and the hamstrings and the quadriceps and the obliques and all these different groups. And collectively, that's your core. And the core, a good, stable, and strong core, is essential for any kind of athletic endeavor, such as playing football, baseball, basketball, playing golf, even things like bowling, whatever. You have to have a good, strong core, and core weakness is one of the root causes that why people have recurring back pain. Now, most therapists and most trainers do not sufficiently address this problem because they're not taking into consideration all the different causes of what drives a weak core. It's not always due to not exercising enough. Sometimes the problem is due to a lack of CNS control, meaning the central nervous system, that's your brain and your spinal cord, that governs all the different muscles themselves. That's why chiropractic care can be incredibly effective at helping to restore core stabilization and core strength. Because what chiropractors do is we restore alignment to the vertebrae, taking pressure off of the nerves and allowing the free flow of vital information from the brain to the muscle groups. So that has to be the first thing that is restored when you want to get your core back. Number 2 is you have to make sure that you don't have asymmetries. And asymmetry is when you have muscles that are firing too much on one side of the body and not enough on the other side. So in other words, you could have the left side of your body firing too much and the right side not enough, or backwards, too much on the right, not enough on the left. Or you can have problems too much on the front and not enough on the back, or vice versa. That problem is also sometimes called cross-body syndrome. And the other issues could be due to structural problems. A structural problem could be due to abnormal posture. It could be due to a misalignment in your pelvis, where your pelvis could be rotated or it could be tilted on one side. And if that's the case, no amount of exercise is really going to overcome that. That's a very specific problem and has to be addressed by rebalancing the pelvis. Also, other problems such as a scoliosis, where you have an abnormal lateral curvature of the spine, that could lead to a weak core. That's not really something that can be helped by, or cured, I should say, by chiropractic. It can definitely be helped by chiropractic, but as an adult, if you have a scoliotic curve and it doesn't have an excessive amount of curvature in it, surgeons won't touch it. So the best thing you could do is to get under the care of a chiropractor and to do specific exercises to restore strength to that. So to get your core stabilization and strength, number 1, you have to get your vertebrae aligned. Number 2, you have to do specific exercises to strengthen and stabilize your muscles, and you have to be very sure that you're not creating any asymmetries on one side of your body or the other. Well, I hope you enjoyed this video and I hope you learned something. If you have any questions about core weakness or back pain, I can be reached through my website at redappleWellness.net. Also, please subscribe to my YouTube channel and please tell a friend. And thank you very much for checking out this video.